The University of Medical Sciences, Unimed Ondo, with support from the Federal Ministry of Health and other organizations, embarked on an assessment of the status of reproductive, maternal, newborn, child, adolescent and elderly health plus nutrition quality of care data collection and use in Ondo and Ekiti States, after intense work which began in 2022 under the Principal Investigator and Vice Chancellor of the institution, Professor Adolescent. Stakeholders in the health sector gathered for a dissemination meeting over the outcome of the assessment.
One of the areas that are particularly important when you think about this are the issue of, one, generating data, but two, how do you put that data to use? We spend a lot of money as a country generating data sometimes, but we are not putting them to use. So one of the things we want to do in this study is to look at the spectrum of what we call RMNCAEH, which is reproductive, maternal, newborn, child, adolescent, elderly, and nutrition.
Over 100 health facilities were visited and subjected to multi-methodical surveys in Ondo State across the various local government areas in the 3 senatorial districts.
Inadequate manpower is really affecting many of the facilities. So many that we still have a lot of. Perhaps this is not unconnected with the problem of mass exodus of healthcare workers across the different facilities. So government needs to double its effort to recruit more healthcare workers and to also train and retrain the ones that are already working.
The principal investigator, Professor Fatusi, while highlighting the findings, stressed the need for concerted effort in the area of adolescent health and training of health workers.
You find areas like maternal health, the life of the mother, there are a lot of information available in our facilities. You go there, you find posters, you find all kinds of information. But when you come to adolescent health, the life of our young people, those are going to be our tomorrow. You find that there's very little that is available. So there are highlights, high points, there are low points. But the good thing is that the state has done very well in some areas.
Permanent Secretary, Ondo State Ministry of Health, Dr. Foluke Aladinola, who commended the research team and the partners for seeking out facts, assured of the ministry's effort to give life to the findings as a guide to policy direction of government.
What we want to do henceforth now is to make sure that all the things that we recommended, we want to make sure that we implement all those recommendations such that we improve the health sector in Ondo State, especially when it comes to training and retraining of staff.
Our counterpart in the Primary Healthcare Development Agency, Dr. Frances Akambiemu, described the outcome as a call to action on the need to re-strategize for optimal service delivery. The stakeholders emphasized the need for more collaboration and synergy amongst all players in the health sector. Zaheed Aribisala, OSRC News.